Okay, going through some most common questions in the dental office. First question of today is, what are root canals? Well, kind of a softball for me today. Root canals. Root canals is a procedure that we do in dentistry where it's a little bit deeper than a filling. If you imagine when you drill through the tooth, wherever the cavities are, think of cavities as like termites inside of wood. It basically eats a portion of the wood and it basically rots a portion of that. And so with regular cavities, we drill that out. Those areas within the tooth are basically as soft as like wet bread. There's literally a instrument called the spoon excavator where we're just like scooping the cavities out. So basically a root canal is something that goes deeper than that. So if you keep on drilling, you hit oil, and that oil is basically the nerve of the tooth. It's the blood supply of the tooth. If the cavity enters the nerve, that's where you typically feel pain, and that's where you hear us recommend, hey, looks like you need a root canal. So we drill into the nerve area, which sounds gruesome, but it's pretty numbed up. And then afterwards, we clean out the nerve tissue and we clean out the tissue within the walls of the canal because that's where the infection is. That's where the bacteria is. And so as we clean out the infection, it allows the body to heal itself. And then we place a filling material in there, except this filling material is not composite like we normally fill teeth with, but it's something called gutta percha. And it's like a rubber inert material that sits inside the tooth. And so afterwards, we will normally do a crown if it's a back chewing tooth because those teeth receive a lot of forces and it requires a crown so that you don't fracture the tooth. So root canals can take between an hour and 2.5 hours, depending on who's doing it. And so it can be, it sounds like a gruesome procedure, but it can kind of feel boring because you're just like sitting there and it feels like the dentist doesn't do anything and they're just like moving their fingers back and forth to get it fixed. So get it done if you want to fix the teeth. Us dentists, we are biased. Take care. Thank you for watching the video. Again, knowledge is power. A lot of times, sometimes a little bit of extra information gives us the motivation and knowledge to be able to change our own behaviors. And so I hope you found this video helpful to you. Here at Atlanta Dental Team, what we really care about is our patients and our family. And so we really want you to gain all the knowledge you can so that you can make the best decisions and save the most money, obviously. Keep your mouth healthy and have a blessed day.